So welcome back. Now the word aphasia is actually Greek, which means without speech. And in 1700 BC, it was the Egyptians that actually first described a few cases of patients that had had brain injuries and then had problems with speech afterwards. But it wasn't until our friend Hippocrates around 400 BC who links the actual problem of the brain causing a problem in speech. And Hippocrates is a very interesting character because he comes from a line of what is called physician priests. So these were doctors, but they worked within the religious beliefs of their time. So his father and his grandfather always worked within the rules of Greek mythology, meaning that if a patient was sick, it was because they were cursed by the gods or maybe an oracle had predicted it somewhere. Whereas Hippocrates really believed that there is a biological reason for all sorts of medical diseases, be they physical or mental. And then in 1861, you have the French Dr. Broca, who actually localizes the part of the brain that, when damaged, gives speech problems, and it's more the frontal lobe. Nowadays, there are many categories or how to view the different types of speech problems, but the easiest way to look at it is two main parts with a lot of little subtypes. So one part is aphasia, and that's where the connections in the brain aren't being made properly or the links are not being made properly. So this is more of a language disorder. And then there is dysarthria, where perhaps this is a more of a motor disorder where the muscles of the tongue or the lips or the back of the throat are not working properly. Now, in the beginning, I actually had both. So I had trouble with word finding and making connections, and I had a lot of trouble with slurring. But as a doctor, when I had my stroke, the minute I found out I had a speech problem, I knew I had to wake up that brain as quickly as possible. And because I was in the beginning bedbound, there wasn't a lot that I could do. I started to do whatever I could. So the first thing I did is I started reading. So I would read everything. So I would read what was written on the boards, like, hey, this is your doctor today, this is your nurse, this is your technicians, etc. When I was being wheeled to rehab, I would read the numbers on the doors or the labels like supply cabinet, medical cabinet, etc. I would read the ID tags on whoever was taking care of me that day or anybody who was transporting me, etc. And then I was also reading the dietary menus like front and back just to make sure that I could still read efficiently. And then finally, when I was able to get my hands on some magazines and books, then I worried about comprehension. And I knew that as a doctor, stimulating the brain more than one way really does help. So reading has a lot of benefits because it gives you that visual stimulation, but then it also has that mental processing. It makes your mind work at comprehending. So comprehending and making connections, etc. And I actually would pretend that I was reading out loud on the inside, so kind of say, hey, this is how I would say this type of thing, to try to get my dysarthria part primed to recover as well. And as well, the speech rehab therapists were amazing where I was at. And they had me do a lot of things, but a few things that really stuck out to me was that they had me read medical paragraphs, and then they would ask me questions to see if I could comprehend them so that I could be able to return to patient care. They had me videotape myself reading to see, like, hey, this is what the patient will see you as. So make sure you move your lips and things like that, your facial expressions correctly. And then they also had me do tongue twisters, which is very important, and that'll come a little bit later. So after my 1 month stint in rehab, after I made it home, one of the first things I did was I actually printed out 500 tongue twisters from the internet, and I would go through them 3 times a day. And this was to clear up my speech. And the ones that were more difficult, I would keep going at, and the ones that were easy, I would kind of remove from that pile. The other thing I started doing was I started watching videos on YouTube of good speakers, like people on TED Talks, to see what they did to articulate their words better, to speak better, etc. And one of my favorite speakers was the educator, Sir Ken Robinson. And because I felt he had this perfect mix of humor and humility and storytelling, but he gave you a lot of information. And I was hoping that once I got better, I would be able to meet him. But, sadly, he passed away in 2022, I believe. So may he rest in peace. And I kept reading. So I would go to the library. I would check out as many books as possible. I would read digitally. And fun fact, I have actually forgotten the endings of a lot of the mystery novels I read. So reading them the second time around was actually a new experience to me still. And then when I went back to work, the things that I did as a doctor differently did so that my aphasia, my dysarthria wouldn't impact patient care is I made sure to be well rested. So I would get a good night's sleep. I start my clinic early and I end it early so that I'm not really in patient care mode when I'm having my deficits become more apparent. Because when I get tired, I will start to slur and I will start to not be able to say certain words. So to give an example, I can say test results in the morning, fine, but in the afternoon, I won't be able to. So I created a list mentally of words that I could substitute. So in the afternoon, I will be able to say lab values just because it's easier for me to say that. So I did create that list to kind of help me along. And I make sure that when I'm in clinic anyway, it's hard for me to write. And we'll get to that some other time. But because I can't write, I actually listen to the patient. To me, it sounds like a short story. And it's a short story where we kind of write the ending together. And then I go back to my office and I dictate the note. And it is tiring for sure, but it is doable and I enjoy it. So it's nice that way. There are things about my speech recovery that really surprised me, even as a doctor. I mean, the brain is amazing. It's an amazing organ. The ability to heal is simply amazing. And one of the things I learned is I actually have to move my tongue differently on the inside to get the right sound on the outside. And I do this without thinking, so it's not something that I even focus on anymore. I do need that list, that mental list of words that I can substitute kind of into conversation, because if I have that list, then I can do it seamlessly and people kind of don't notice it per se. And I do also notice that when I get tired, no matter what I do, I will start to slur. It's not something that I can stop. It's not something that I can take, 2 Tylenol for if I have a headache and just, wait it out. It's not like that. It's something that just happens. And then the only way for it to reverse itself is for me to get some really good rest. So I did learn that. But again, as I said, the brain is amazing. It's an amazing organ, its ability to heal itself. And now I do all these things without even thinking about it. It's like, you don't think about your heart beating, right? So I don't think about all these speech things as well. And you will see that my basic approach to try to recover from my own stroke, as a doctor, I use kind of a basic formula that I use for many things, not all things, but most things, is that I would identify the problem and I would come up with a solution that worked for me. And then I would practice, and I would make sure I practiced correctly, because remember, practice makes permanent. It does not make perfect, it makes permanent. So I would make sure to practice correctly what I could. And I would keep the right attitude and try to keep at it day in and day out and not give up hope. As the British writer George Herbert would say, to him that will, ways are not wanting. Until next time.